The second time though, I went in for the extraction and was in the room sitting on the dentist chair, and the surgeon came in and introduced himself and was asking the nurse to begin administering the nitrous oxide. And as she put the mask on my face, the surgeon told me to take a big breath, like I was taking a hit off a bong. And I looked at him and must have said something like, "What?" Parentheses, because it's really weird to have an adult male dentist telling a patient to pretend that anesthesia is like a street drug or whatever. It was unsettling or disconcerting or something of that weirded out kind of reactive nature. And he was like, or breathe in and out like you're going into labor. Parentheses, which I thought was also kind of a weird thing to say, but whatever. Close parentheses. So I breathed deeply, but didn't feel any different. The previous time, once the nitrous oxide had begun working, I remembered it very clearly because I am in a constant state of tension in everyday life. Like all the time, every minute of every day of my life. And while having that tooth extracted, the nitrous allowed me to be relaxed to a degree where every muscle in my body wasn't coiled tight with tension. And my mind was actually able to relax to some degree. But the following time with the bong hit dentist slash surgeon, I didn't feel any relaxation. Or surgical sedation at all. They'd given me a lot of Novocaine, parentheses, or whatever the surgical equivalent of regular dentist Novocaine is, if there is a difference, close parentheses. So I didn't feel pain, but I did feel complete tension, parentheses, as always, close parentheses. Complete awareness of what was going on around me. It was as though there was only oxygen in the mask with no nitrous. I was going to try to tell the guy, but he and the nurse were both pushing their full body weight against me from each side, as though pinning me in like we were on a football field or something. I read this book once called A Million Little Pieces about a guy who goes into rehab and has to get a cavity drilled, parentheses, it might have been a lady, not a guy, I can't remember, close parentheses. And when he's at the dentist, he's not allowed any Novocaine at all because those are the conditions / rules of his rehabilitation / sobriety stay. The way the nurse and oral surgeon were pressuring my body between them so hard reminded me of that book. Like, maybe that's a way doctors deal with patients who aren't allowed medications. It also reminded me of the scene in Jarhead when Jake G and his partner are waiting for the chance to shoot a guy in the tower across the way, and their superior officer comes and tells them they can't take the shot and gets on the radio saying Hitman 45, and Jake's partner, Peter Zerg or something, flips out on the radio guy, and then has a screaming meltdown, and Jake pushes him against the wall to calm him down. And you can see he's using all of his force/pressure up against him. Except I'm not a Marine on a battlefield having a tantrum, nor a drug addict in a rehab center that disallows anesthesia for dental visits. I'm just a regular law-abiding citizen who is getting a tooth extracted and who ended up going into some degree of physical shock or severe soreness from such pressure that my whole body was in incredibly severe pain and shock for most of the following week, and I still don't know why or how that happened. I did mention it to the dentist/surgeon at that point, but insisted/assured me that I was receiving nitrous despite my body remembering the feeling of being sedated for surgery a month or two earlier, and definitely not feeling that way the next time.